All right, welcome everybody. It is Wednesday, the 21st of September, and we are restarting our guest speakers series. We took the summer off and enjoyed some travel and vacation, but we're back and we're starting out with a superstar. We've got a wonderful topic and a wonderful subject matter expert who's going to share some very interesting information to help us make New Mexico a more desirable place for active duty and their families to live and be stationed. So I would like to welcome everyone. Thank you for joining us. And I'd like to introduce Kelly Mae Douglas. She has served as the state liaison covering the Pacific Southwest region within the Defense State Liaison Office, Office of the Deputy Assistant Secretary of Defense for Military, Community, and Family Policy since 2018. That's a mouthful, Kelly. In this role, she serves as an expert resource on a variety of quality of life issues affecting service members and their families, providing relevant information and research, knowledge of policies and processes, and assistance with state legislation to policymakers and military leaders in California, Arizona, Nevada, New Mexico, Utah, Hawaii, and the Pacific Islands. That's not a bad travel.
No, I'm not complaining.
And prior to joining the DSLO team, Ms. Douglas served as a K through 12 policy advisor and regional school liaison program coordinator for the Marine Corps, an elementary school teacher in several states, and the Department of Defense, and a special education advocate. And Kelly is a proud daughter of a career Marine Corps family.
Hoorah.
So, welcome so much. I'd like to mention to people, please put any of your questions in chat. Kelly has got a presentation, and then she's going to go over the top 10 items for our legislators for this upcoming session, and then we're going to take questions. Okay, so without any further ado, it's over to you, ma'am.
Okay, great. Thanks for having me. I'm really appreciative of the invitation. This is really exciting for me to be able to chat with you guys and just share what my office is up to and things that we're hoping that New Mexico can do in partnership with us to improve the quality of life for military families in New Mexico. I will say, Claudia, that was a great introduction. Thank you. I know that was a mouthful. So New Mexico is, we did a little bit of a region shift. So New Mexico is my newest state in my region, was added to my portfolio in January. So I'm still learning, and I appreciate you bearing with me and teaching me what I need to know about the community in New Mexico. Really looking forward to visits. I've already visited a few times, but always willing to come over your way. I am based in San Diego, just for reference. So with that, I will go ahead and get started. As Claudia mentioned, I'm part of the Defense State Liaison Office under the Undersecretary of Defense for Personnel and Readiness, Military, Family, Community, and Family Policy. Our office has been in place for, about 18 years now, and I joined again in 2018. And our job, really, our focus is on working with state policymakers to address a variety of quality of life initiatives, issues that are facing the military community. Really understanding that that many of the issues that are facing our families are state specific and not under the purview of the federal government. And so really just working in partnership with states to make progress in these identified areas. We've, over the last decade, we've helped policymakers pass over 1,000 bills that are related to a variety of quality of life initiatives, K-12 education, family law, service member protections, veteran preference, voting, healthcare, and National Guard support. Next slide. So as I mentioned, we work with state policymakers. We identify right now, and people like to call our list the top 10 list, and it does typically stay focused on 10 key issues. However, when we retire an issue, it's not really retired. If states want to address former issues, we also will cover those as well. So it's actually more than 10, but 10 that have been identified in a given year and approved by the undersecretary for us to work in the states. So the considerations that we use when we're determining what issues to work in the states are the importance and the relevance, current relevance to the department and the military services, and also the feasibility of the majority of states being able to address and approve policy in that particular area. And just have here a link to our website where we have the status of each state in terms of our initiatives. So we have a map. You can go to each of our issues and see where New Mexico stands on each of those issues. Next slide. And this is just a kind of a rundown of the current priority of the department regarding quality of life initiatives, particularly K-12 education and military spouse career and licensure portability. Next slide. So I'm kind of put our issues into buckets. So the first one is K-12 education. As far as the coming legislative session, we're still working Purple Star Schools program, which New Mexico approved in 2021. We also have an issue called open enrollment flexibility, where we are asking states to consider that military families often have to move subsequent to a PCS move, a permanent change of station, due to limitations in housing wait list, and that sort of thing. So we understand that New Mexico currently has open enrollment. However, one thing that we're asking is that the state consider adding a military priority to the existing priority list that exists. Next slide. So the next area, and I'm sorry, the slide, I think it cut off some of the words there, but the next bucket is around health and well-being. So several issues here in this area. One of the asks that we have is that licensure, that states consider exempting military, so family childcare providers that are certified by the military services, exempting them from state licensure requirements. So what we have found is that the DoD requirements and the state licensure requirements are very much redundant. And so we are really trying to ramp up the availability of childcare for our families. We're deficient as it stands, I believe, close to 2,000 family childcare provider spots that are available are vacant. And so really, this is one of our top priorities because even though New Mexico has done a wonderful job with licensure portability policies, one thing that we found is, no matter how much we provide this portability for military spouses to gain employment, if they can't identify childcare, then they're still unemployed. So this is a top priority for the department. We have an issue around called defining armed forces in state policy, and it's really very simple. We're just asking that states look at their definition of armed forces or uniformed services in their statutes and ensure that the Space Force has been added. The third, sorry, can you go back one slide? The third issue that we're working this year is the military and family life counselor licensure waiver. This issue is really the core, and the goal of this issue is really to be able to provide increased mental health supports for military families. So the Department of Defense contracts mental health providers for short-term mental health support in military units, also, so on base in military units, but also in schools, military impacted schools, and community centers and childcare centers. However, we're finding that states are having trouble, we're having trouble retaining and recruiting additional military family life counselors because they, even though they are contracted with the Department of Defense, if they're off base, they have to be state certified. So we're asking that states consider allowing these DoD contracted mental health providers to be exempt from state specific requirements. They are already licensed in another state. However, we have vacancies in what we've funded because we can't recruit out of state licensed counselors. Another issue that we're working is regarding concurrent jurisdiction. Essentially, the department is wanting to ensure that, and this really is around juveniles. So if a juvenile military dependent is accused or commits an offense on a criminal offense on a military installation, we want to make sure that there's concurrent jurisdiction between the federal and the state government over the juveniles so that their cases can be adjudicated and we can provide them with the state can provide them with resources because they don't fall under the UCMJ, the Uniform Code of Military Justice. There's kind of a gap there where these cases are falling through the cracks. I believe that this issue is under review, so it's currently being looked at. So I don't currently have sample policy for New Mexico quite yet, or a recommendation quite yet, but it should be coming in the next couple of months to determine if state statute is amendment is required to add any additional installations to be authorized to request concurrent jurisdiction from the state. And we have another issue, child abuse identification reporting, that New Mexico has already implemented. Next slide. Finally, we've been focusing on really trying to ensure that military families are financially secure by ensuring that that military spouses are able to obtain employment as soon as they arrive at a new duty station in a new state. And our approach to this is threefold, but it's all focused on relieving barriers to licensure when spouses are moving from state to state and they are in a licensed profession. So the first kind of the best gold standard that the department is really focused upon is licensing compacts. Currently, there are 8 existing occupational licensure compacts for state that are available for states to join. Currently, New Mexico has approved only one of those 8, and we have 5 additional compacts coming in 2023, including the teacher licensure compact and 4 other compacts, barbering and cosmetology, massage therapy, and others. So that's a big focus of ours. I see, Claudia, and I see questions coming through, but we're just going to save those, right?
Yes, absolutely.
Okay.
They're just being queued up, and then we'll ask once you're done with your presentation. Yes,
Perfect.
ma'am.
I didn't want anyone to think I was ignoring them. And the second tier, kind of the second approach to our licensure issue is asking states to look at their existing licensure policies for military spouses and ensure that military spouses are able to obtain a license within 30 days with minimal paperwork if they already have a license from another state. New Mexico has already taken care of that with legislation in both 21 and 22. And we're also, and additionally, we're asking that state boards have easily accessible information on their websites for military spouses to be able to navigate very easily when they receive orders to the state. And New Mexico, again, has already taken care of that. So we'll dive in a little bit deeper into the licensure piece, just to kind of emphasize that the focus for New Mexico for DOD is working with the state to see where we can relieve maybe where there's some barriers with the legislature in terms of being able to consider these compacts. As you can see here, the top, we have a continuum that we look at: immediate, near term, and long term, and we see compacts as the long-term solution to creating true reciprocity for service members or for any professional coming into the state, but not only coming into the state, but also ensuring that when they leave the state on military orders, that they're able to transfer their license very easily. If New Mexico were to join more of these interstate compacts, that would enable spouses to freely move between states with their license without really having to go through additional processes. Next slide, please. And again, I mentioned that we consider licensure compacts the gold standard for reciprocity. And as you can see here, these are the compacts that are currently active and available for states to consider. And New Mexico has joined the NERSC licensure compact. Next slide. This is just a screenshot of our website, our webpage map that I explained, where you can look at the status of each state. This particular screenshot is regarding the licensure compacts. So we have it differentiated in groups of kind of percentages for each state, percentage of compacts that have been passed so far. So the gray is no compacts passed. So I have some work to do there in California and Hawaii as well. Then the light blue there is less than 25% of compacts passed right now with 8 compacts. That's for New Mexico, that's one compact that has been passed. And then you could see the gradation. So the orange is 25 to 49%. The purple is 50 to 74% of compacts passed. And then 75 to 99%. And then the green is those states that have passed all the existing compacts. And again, this is going to change when we go from having 8 compacts to 13 next year. Next slide. These are the new compacts that are coming. And so in 2020, NDAA authorized DOD to enter into cooperative agreement with the Council of State Governments to fund additional compacts, the establishment of additional compacts. So the NDAA authorizes up to $1 million per industry to create a compact that states can then join once the language is final through legislation. So as I mentioned, teaching is one that we're really, really excited about. There's a lot of talk about the Interstate Teacher Mobility Compact, and a lot of excitement, a lot of momentum and support on that one. We also have licensed clinical social workers, cosmetology and barbering, dental hygiene, and massage therapy. Next slide. And that's really the rundown of my office in as brief of a way as I have figured out to explain. But here's my contact information, our website, and happy to take questions, or Claudia, however you want to approach it.
Sure, that's great. So Kelly, did you want to, or Ivan, would you like to put up the sheet with the
yes.
10 different priorities for 2023, sir?
Okay, hang on just a minute, please.
Okay. That was very interesting. I've got a bunch of questions, but
Okay.
I'm not going to start because we've got
I'm
some
ready.
queued up. Yeah. And we've got one more legislator that's trying to get on. So I think
Okay.
Representative Marion Matthews will be on board soon. But I think we can start with the questions. Taurus, would you like to ask the first question, sir?
Thank you, Madam Chair. And thank you so much, ma'am, for your time today. That was a very good presentation, and I enjoyed it. Our first question comes from Kathleen Holmes Cates, and it asks, why doesn't the mental health provider's license fall under the reciprocity that was passed last year?
That's a great question. So I'll have to look. Each state is different as far as which mental health providers were covered under statute. You probably know that there's a lot of different categories of mental health providers. You have licensed clinical social workers. You have marriage and family therapists. That is a good question, and I can definitely follow up and see if they're covered. If they're covered under the existing statute, then that would be wonderful. I have a feeling that perhaps maybe it covers one or two of the types of counselors that are employed under the DoD contract, and maybe not all of them. But I'm going to hope that perhaps they're all covered.
Okay, Kathleen, does that answer your question, ma'am?
Yes, I at the beginning of the presentation, I thought I heard her say that nursing was the only category of reciprocity, but by the end of the presentation, I saw the categories, and social worker is in one of those. But you had said you needed more mental health providers that could work across state lines, and so that's why I asked that when I did.
Yes, so and there really is that distinction between current state specific, like, so New Mexico legislation policy regarding the enhanced spouse licensure piece about being able to be licensed in 30 days. That's one kind of approach. The other one is regarding the compacts. And the interstate compacts are an agreement amongst states. And so that's why we say that's true reciprocity, just because it's long-term, it provides that back and forth, the mutual move between states, instead of just covering the immediate need of military spouses that are coming into the state.
I'd like to follow up with a question on that. Can you explain a little bit what these compacts are, and maybe give an example, or maybe give an example?
I'll use the nursing compact, since that's the compact that was approved through legislation in New Mexico in 2018. So the interstate compacts are an agreement amongst member states. So a national organization such as the National Board of Nursing will establish language. It will go through a public comment and period. It will receive kind of review from all of the states. At that time, they come out with a final language that is kind of the model language that really is the kind of the template that states would join. And so any state that wishes to join that compact would then become a member state, and then they would allow what's called a privilege to practice. So a nurse, let's say a nurse is licensed in California in nursing, and let's say California was a compact state. Now I'm thinking that's not a good example because California is not a compact state, but let's say that California were a compact state and that nurse came to another compact state, to New Mexico. They would be issued a privilege to practice in New Mexico from their home state of California, or vice versa, and really just be able to begin working as soon as possible. Of course, they still have to go through the normal background check and legal requirements. But as far as licensure requirements, that's already been met through the agreement between the states.
So, I think I heard you say that it can be as fast as like 30 days. So if an active duty member is moving here and her husband is a nurse and she's practicing in Utah, for example, and comes to New Mexico, could that spouse be working within 30 days if we had signed on to these contracts?
Well, because of the recent legislation that New Mexico has passed, the spouse could, if covered under, if that occupation was covered under the existing legislation, which, for example, nursing is, they would, under the current policy now in New Mexico, they will be able to start working within 30 days without the compact. However, that doesn't address their those that are leaving the state. And with the compacts, they actually can get to work as soon as their background check comes back. So even sooner.
That's fantastic. We could certainly use a lot more nurses. We could use a lot more of everything here. Anyway, Taurus, would you like to ask the next question, please, sir?
Thank you, Madam Chair. Actually, it is your question. Madam Advocate, how is it that you evaluate the effectiveness of the Purple Star School program?
That's a great question. And this is an evolving development, but as it stands right now, so the Purple Star School program, I believe when we started working on it last year, I believe there were 8 states that had joined, had implemented either through legislation or through Department of Education policy that had implemented the Purple Star School program. Since then, in the last year and a half, I believe we're at 35 states, so it's been extremely popular. However, you ask a really great question about evaluating effectiveness. That was something that we were really interested in coming into the summer, this summer, with all of the success of the legislation and the policy implementation. We wanted to know, how will we be able to evaluate effectiveness? So we actually contracted with with Penn State University, and they are currently in the middle of a research study that we commissioned to look at every state and how they're implementing not just the Purple Star School program, but also our other initiatives, advanced enrollment, the Interstate Compact for Military Children, and open enrollment flexibility. So we are currently looking at that, and hopefully we'll be able to have results from that study by spring of 2023.
That's really good to hear because, we primarily work with legislators and they've been so receptive and so helpful and want to know, what New Mexico needs, what our veterans and military families need. And I know that they do their part, but if the programs, in fact, aren't really implemented,
Right.
or they're not implemented fully to be effective, it feels like they're wasting their time. So good. I think a report card, not just on the legislation, but how effective these programs are, would be excellent.
We learned that through really our last decade working on licensure, that we most states passed legislation on spouse licensure 10 years ago. However, what we found was that when we talked with military spouses and commanders, there still seemed to be a disconnect in terms of, even if it was being implemented in the states, that it really wasn't having an effect. And that's why we had to go back. And we also commissioned a study on licensure in 2019. And that's what led us to really led us to compacts and asking states to ensure that their policies were accessible.
Excellent. I'm going to go out on a limb here, but speaking on behalf of the wonderful legislators we have, I think we'd be very interested in knowing how New Mexico is implementing these programs, because I know their intentions are good, but I want to see what happens. So, okay, over to you, Taurus.
Thank you so much, Madam Chair. Ma'am, this one is a little bit complicated, so we're just going to take it piece by piece.
Okay.
The first part, this is by one of our leaders by the name of Myrna Brostoff. At first, it says, are state licensed facilities NAEYC accredited? The second part says, what type of monitoring and oversight is there in terms of home care caregiver child ratios? Are infant and toddler ratios monitored? Finally, do state licensed facilities have access to state resources for feeding and meal menus and supplemental resources? Your floor, ma'am.
That is multifaceted question. In terms of state facilities, I can't speak to that. I'll admit that up front. In terms of DoD certified family care providers, they are accredited. I'll have to double check and make sure that it's the same accreditation that you referenced, but I believe so. It sounds familiar, but I don't want to misspeak, so I'll have to follow up on that one. But the DoD certified family child care providers are monitored by the services, by the installation. They have inspectors. They have a whole program that monitors and checks on family child care providers. I believe it's monthly. They do visits to ensure that they're within regulations.
Okay, thank you.
Mm-hmm.
That may have been directed to somebody else. Go ahead, please, Kelly.
Oh, I'm sorry. Are there additional?
Oh, did
Did I
that
catch
answer
everything?
I believe you did, ma'am. Thank you so much.
Thank you. I can follow up too on any of the questions.
Okay, terrific. We'd love to have the answers back, and then we can send them out to the folks who are visiting here.
Absolutely.
Okay.
So I'm kind of I'm the messenger, but we have subject matter experts in each of the areas. So if it's, school question, I can go back to our school liaison program manager. If it's childcare, I can go to our childcare experts and just make sure that we are speaking the truth.
Okay, and Taurus, let's continue to go through the questions in chat, and then we'll take some questions live from participants who have their hands up.
I love
Wonderful.
all the
Thank you
questions.
so much.
Thank you.
Ms. Douglas, this is from Kathleen Holmes Cates, and she asks, what does the Department of Defense specifically want from state child service communications to the military? Do they want notification, side-by-side services, or referral?
Good question. So just to clarify up front, thank you for that question. New Mexico has already met our what we were looking for states to do. Just to clarify that we're not actually asking anything further on that piece that's been addressed in New Mexico. However, I will, just for edification, what we're asking is twofold. One is that that state statute allows the local child welfare services to establish MOUs with the military installations, so that it details about access to the bases and how cases will be handled can be addressed at the local level. So that's one piece, is authorizing the MOUs. The second piece is asking the state to share if there's alleged case of child abuse or neglect off the installation. Let's say out in the civilian community near a base, that the local authorities will notify the military command and when I say command, I mean through the Family Advocacy Program, which is a DoD program that provides resources for families that are at risk. So we're asking for that notification and that collaboration and communication to occur when there are suspected cases involving service members.
Kathleen, does that answer your question, ma'am?
Just for clarification, Kelly, so you're saying that as of the 2020 legislative session, that is already in place, that these MOUs can be established, and now the civilian services, when there's allegation of abuse, will be notifying family services on the military?
Yes, that there's that
in that requirement or non-requirement or whatever it's laid out in the MOU.
Yes. And I can, Ms. Cates, I can also follow up and with the copies of the MOU and the reference to the statute.
Excellent. She's going to be working in the legislative body this coming year,
Oh, great.
getting her elected. All right. Go ahead, Torres.
Yes, ma'am. This is actually a follow-up question also from Ms. Kate. Is the Nurse Compact the only compact that the state of New Mexico acknowledges?
I think she already answered that. Sorry. Let's go to the next
Oh,
one.
that's all right.
That's okay.
Thank you, ma'am. All right. So, Mr. Bob Carroll asks, who in New Mexico approves the licensing compact?
So the legislature has to approve the compacts.
All right. Excellent. And then
I want to ask something here. Excuse me. Don't we need to also go through the New Mexico Regulation and Licensing Department?
Typically, we need their support, yes.
And does that happen independently of legislation or after?
It's a good question. Usually what happens is that so DOD doesn't take the lead on the compacts. We follow up with support as far as how the compacts benefit the military community, because the compacts are not just related to military spouses or the military community. It's for professionals across the board. So it's not our lead issue, but usually what happens is if a board expresses interest or they take the lead in moving legislation forward to enact a compact in a state, we work with them and we support them. But if a state board is not supportive, it usually doesn't go anywhere. We don't even pursue it.
Okay. Thank you. Back to you, Torres.
thank you, ma'am. Ms. Douglas, I appreciate all the time you've taken answering these
Thank you.
questions. We're down to our last one from our chat. Ms. Myrna Brostoff has a follow-up question. She asks, why can't the Department of Defense increase compliance on compacts with state legislatures by ensuring that the Department of Defense will, when it comes to something like contracts, offer preferred status to those states which comply with compacts?
So if I understand the question correctly, it's more, is the question really about preference, like DOD providing preference as far as what, basing or?
What I'm saying is put a little pressure on the state legislatures, the carrot and the stick, like, hey guys, get with the program, approve these contracts and you'll be these compacts, and you'll be one of our preferential providers. Light a fire under some of these schmoes.
One thing I'm glad you said it, not me.
Yeah.
But I will tell you, and this was one thing that I didn't really focus on when I went through the brief, but one of the last kind of actions that the department and Congress has taken in terms of encouraging states to earnestly consider compacts is incorporating the extent to which states join these compacts into military basing decision models. So within the NDAA, all of the services are required to evaluate whether a state has joined compacts or not and to what extent, in terms of and this is not just obviously it's not the only consideration that would be looked at in terms of a basing decision. However, it is required for us to look at whether a state has really partnering with us on the compacts.
Absolutely. You have to put a little pressure on these folks and you can you can give points to it. I mean, I came from Massachusetts to New Mexico. I passed the bar in Massachusetts and as a nurse, and I was able to work here. Now, I understand there are different requirements, like an architect, for example, or a lawyer. You may have to have access to certain codes that are state specific, like California, where there are earthquakes, and you may have to be more conversant with the codes. But in terms of nursing and psychology and the kinds of services that our veterans and their families and spouses really need, those kinds of things have, similar requirements on a state-by-state basis. And I just don't see why there's such an obstacle. It's embarrassing. It really is. And I am really upset, to tell you. Until I got to this presentation, I did not realize how poorly New Mexico was doing. Pisses me off, let me tell you.
I will tell you, and I appreciate that passion, and I appreciate the support. I will say that there is a silver lining. There's a kudos that we can celebrate, which is, I believe earlier this month, New Mexico Supreme Court just finalized and approved the military spouse rule to allow that allows military spouse attorneys to come into the state and be able to work on another license. And so that's great news. It's the military JD network has put out a press release really congratulating New Mexico on that. So definitely wanted to share that good news as well.
Okay. You've got a big job and a lot of work to do. You could use some more help.
Yes.
That's what we're trying to do here, is recruit some help. We've got some existing sitting legislators, and we've got some candidates, and we just want to get them fired up and give them the right information and get the resources that Kelly can support and supply to them, so they can write the bills and we can follow through and make sure this is happening. Yeah, no, I appreciate your questions, Myrna. It's very good. Shannon Reynolds, you've got your hand up, sir.
Yeah, I do. Thank you, Claudia. Kelly, thank you so much for the presentation and also the cooperation and willingness to work with us and to listen to our complaints and questions. That means a lot. I have two things. Number one, do you have sample legislation that you can share with us on each one of these things that we can actually present to our legislatures as examples to work from?
Yes, we do.
If you can't, okay, we'd like to have that sent to somebody like Claudia.
Absolutely.
And so we can distribute it to the legislatures completely and when we ask them to do this. The second thing, and I go along with I think Myrna and what she said. I'd like to say that if we'd like to have some sort of bar that you can tell us that will help us to be more favorable when you're considering new missions to bring to our bases. I.e., of course, White Sands is a highly critical base. So is Fort Bliss for deployment. So is Alamogordo, Holloman. Okay, those are all critical bases, which, as far as I've heard from the Pentagon on my visits there, there's no plan to close them down. However, it's really critical that if we can have some sort of bar with this kind of legislation that we can set for our senators and representatives to help us to get more missions brought into the state and other things we can do. I think that's critical too to what we're trying to accomplish in this board or with this caucus. Okay, so
Absolutely.
Thank you.
Thank you. And I can share that NDAA language, the basing language, that should, I think that would be helpful. And just know that, when the services are considering, and when I say basing decisions, you're right, we're not talking about closing per se, but if they're looking at new missions, they are not going to be sending, I shouldn't say not, absolutely, but they would prefer not to send families to areas that they don't feel would support the family. And so when the services are in the midst of a mission basing decision, they send us a rubric and they ask my office to complete basically an evaluation that a form where we have to share, what the state has or hasn't done. And they use that as part of the decision.
Make sure they know that we are a much better place to locate Space Force headquarters here than Alabama or Huntington. Is it Huntington? Huntsville? Yeah, because we've got these unferreted access to space from here. So, they should be moving them to northern Doñana County.
Understood.
Okay, at the spaceport. Thanks.
I'll let them know.
And I think what we say is the first mile is free. We're a mile high. So, Greg, I'm going to turn it over to you, sir. You've got a question?
Awesome. Thank you, Claudia. And Shannon, just real quick, want to point out that was Kirtland that was getting considered for Space Command headquarters. But White Sands is a national treasure, and we absolutely should do everything we can to bring missions there. I want to add a couple of
Greg, you have no space, Greg. We have space here, okay?
Right. The interesting thing about Space Command is they're not launching anything. So that was why Kirtland, but totally with you. Two things real quick. I want to say real quick, having been able to work with Kelly's predecessor, who was a great guy, ton of respect for him. We're in really great hands with her. Her responsiveness and literally, I one day emailed her and she hopped on to provide testimony for spouse licensure issues to the state legislature that same day. So just thank you so much, Kelly, for all the work you've done, for flying out here to Albuquerque to testify in front of the legislature. All of it has been stellar. Really grateful for all of your work. I also want to point out a couple of quick things on stuff that's come up before. One of the things that's held up our signing on to licensure compacts is in part a capacity issue with the legislature having many priorities on its schedule and a short sessions, all that kind of stuff. But there's also always resistance from the professional associations that count on the fees that people have to pay when they move to a new state and re-up their license. And it's gross, but I'll be honest with you, even when they don't fight against these changes, they sure as heck aren't joining in to help move these things along. So if you're a member of a professional association, and again, the exception to that I would say was the nurses, who were, their professional associations were very involved in getting that legislation passed at a federal and state level. But if you're involved in a professional association, become a member and advocate up that, these licensing compacts matter and the difference in fee structure is negligible compared to the benefits long term. Second thing I would say is on the child care thing, New Mexico has passed universal child care, and the DOD's updated programs here, I feel like we're not utilizing as much as we could be. The DOD standards for child care are actually much more stringent than state level or local level standards are. So childcare, especially in our international district, which here in Albuquerque, I'm giving one base, is an area where we could really use the economic development. We should be starting childcare centers that serve the base, because the base doesn't have the capacity at the child development center to get all the kids in there. So if you get in this DOD program, there are many benefits to it that the childcare provider itself could utilize from DOD to stand up childcare that will serve military families. That's a big one that's going to take levels of coordination between chambers, economic development groups, etc. Right? We want to see those programs, and DOD has given a big tool set for us to take advantage of, which I think we've only started to scratch the surface on, at least locally here that I know of. Last thing I want to say is we had something come up in a meeting today that I want to just specifically ask a question on, Kelly, and I'm sorry for being so long-winded here, but we had a question about funding for a program here in the state called the Governor's Challenge and the Mayor's Challenge to address suicide for veteran military families. We know that a big priority for DSLO is the Ask the Question campaign. I'm wondering, is there a way for us to reconcile those two complementary priorities in how we talk about this going forward?
Sure. Thanks, Greg. And first, I just want to thank you for the kind words. It's been a pleasure and very lovely working with you. And you are one of the key people, you and Claudia and others, that have really taken me under your wing and given me just chapter one of working in New Mexico. But I am really enjoying it, and I really appreciate your support. So just want to say that up front. And I'll get to the challenge just in order. So as far as the compacts, you're 100% correct. We have heard that argument about fees, and it's just not, like you said, it's not equal to the value that the compacts really provide all of the states. Childcare, those were great points. I just wanted to point out one thing that I didn't bring up, in addition to the childcare, the licensure exemption that we're looking for. DOD is currently in the middle of what's a fast track implementation program of a childcare subsidy program. It's called Military Child Care in Your Neighborhood Plus, and they're asking states to join this to look at that initiative. It requires that providers, civilian providers, so this is not military providers, civilian providers can receive a military subsidy for providing childcare to military families if they meet certain quality requirements. It's called the Quality Rating something system, QRIS. So that's something that the department is looking at, and that is not legislative. That's not a legislative request. That's we're just basically offering money to additional civilian providers to serve our families. And I love the point that you made, Greg, about universal childcare. That is one thing that we're really kind of balancing. Obviously the department and the administration is all about universal childcare, universal pre-K. One thing that we are seeing, though, as far as a challenge that we can work with the state on, is that the CDCs and the family childcare providers that are providing childcare for 0 to 3, right, like before pre-K, are now losing. They're losing some of their revenue, some of their clients, right? They're losing a lot of kind of their core service, to students or children that are in preschool age. So that's different than the universal childcare, but that's one thing that I think that this child subsidy that or childcare subsidy that we're providing to civilian providers, and if we can get more military family childcare providers recruited by exempting state requirements, I think we can kind of mitigate that, because universal childcare in preschool is a win-win for everyone. Oh, finally, yes, important question about Ask the Question and about the mayor's and governor's challenges. I have to look at, someone had asked me, and I'd seen a list of how many states have or cities have implemented it, and it really has grown in the last few years. We do have an initiative called Ask the Question, which is not on our current list. It's falling off the list, but it's what we call an emeritus issue, so we are still working it. But what that initiative does, it asks states to require state agencies, to inquire about the military affiliation for any of their clients that come in at intake, that they ask if they have ever served in the military. And we're very specific about that question, that it's not, are you a veteran, or do you have a family member that is a veteran? Because we found that some people don't, for whatever reason, don't consider themselves a veteran if they didn't serve in wartime, they weren't in combat, if they only served for 3 years, if they didn't retire. So we found that if you ask, have you or a family member ever served in the military, it really pulls everyone in, is much more inclusive. And then at the point that the agency identifies a military connected person, they also, this initiative is asking that agency to connect them with their state veteran services, and also share information about federal VA benefits available to them. So I have seen, Greg, to your connection with the mayor's challenge and the governor's challenge, I have seen some states connect the two. Arizona, I was working on legislation last year, didn't pass, but they actually were directly connecting those two things. So I think that synergy is there, and I think that moving forward, whether it's one of our key issues or not, I think that's a best practice for states. Thank you.
Do you know how recently Arizona did this, Kelly?
Actually, Arizona didn't pass that legislation, but I'll kind of share with you I can share the language that was developed, and I'm going to go ahead and blame COVID on that one. But hopefully we can work that through. California just passed legislation on Ask the Question this past Saturday. It doesn't connect to the governor's challenge and the mayor's challenge, but that is definitely a recommendation for implementation that I would like to provide to any state that passes that legislation.
Please send it our way and we'll send it out to our legislators. Terrific, thank you.
Mhm.
And thanks for the questions, Greg. Shannon, you've got your hand up, sir?
Yes, I do. Claudia, thank you again for recognizing. Kelly, based on some of the things that Greg said, I remember when I was at the Pentagon that they mentioned there's a legislation that actually says if you've got a position that was ever held by a military person, that it's difficult to replace them with a civilian. And they said that in a remote base like White Sands, they really struggle with that because a lot of the positions there, when they first, because it's so remote, were actually filled by military people. And it's really difficult to get civilians now to go in and replace them. And I know that that's legislation has to be changed by the senators and the representatives, or at least get some sort of exception. And I'm hoping that your office will kind of jump on that board as well and try to help our legislators understand how restrictive that is when you're trying to get the public well, the non-military actually involved in trying to support some of these activities at the base. And I think that kind of limits us in a remote base like this one. So that was the one thing. And the other one is that when I was talking to the colonel, who's it's called anyway, the commander, base commander, that actually garrison commander. Sorry, the garrison commander. He's interested in actually trying to replace a lot of stuff with civilian contracts. The problem is that some of the stuff that we need to do is not funded. Basically, it's unfunded things that they want to get done, and so he's got to figure out a way that we can actually create a savings by taking it out to the public that he can recognize, so he can get approval to actually use civilian organizations and companies and contracts in order to do that. Maybe that's something you could also help to educate us on by providing some sort of samples of successful things that have been done around the country to help come out. So does that make sense?
Yes, understood. I'll say I don't have an answer right now, but I will say just, in my region, going to remote installations across the states, I've heard that at every single command and installation visit I've gone to. So that it's a big issue. It's also recruiting and retaining civilians once you have them is another issue in remote areas, and being able to provide competitive salaries is a huge issue because the military is constrained to the requirements within the GS and NAF system for funding, and so even if a commander wanted to increase the salary for let's say a GS 7 so that they can compete with the local community, they can't do it. So that is being looked at Congress. I have seen language in the NDAA on that. So to be honest, we'll need to do some research for you and look and see what's being looked at right now. But I have seen reference to civilian, getting civilians on. Now I don't know about that piece about converting military positions to civilian or contracts, but I'll see what I can find.
No, I have it in I know I have it in my notes someplace what it is, but it's something 24, something like Action 24 or something like that. I was actually talking to the head of the Army, or the person that was responsible at the Army to make sure that the families were actually being taken care of well. I can't remember his name. I've got it in my notes again, but that's what the discussion was about. And yeah, it's going to be a challenge. Even if we give them the right to practice in the state and they're at a remote base, they may want to work on the base and not be able to do that. So I think that would help us for you to help us to kind of pull those things together.
Absolutely. Thank you.
And Shannon, I just want to draw your attention to the chat. Greg has put in a website there. So if you want to click on that, you can take a look at it after the meeting. And Spike, you've got your hand up, sir.
Yes, actually, I have a question for Myrna. the answer to which Kelly and I would both like to know. How do we identify who the schmoes are in the state legislature? Who are the schmoes in the state legislature? How do we identify them?
Legislative report cards, Spike.
Okay.
Well,
All right.
simple. You ask them, are you a schmo? If they're being honest, they'll say yes. If they lie, they'll say no. That's
I
how
like
I
that.
say it. Everybody's a schmo unless proven otherwise. That's my mantra.
Okay. Well, we have some schmoes in our legislature, but I won't mention any names tonight. Okay. Thank you.
All right. Do we have any other questions from the audience this evening? I don't see any more hands. Kelly, this was awesome, very informative, really helpful. And I think we've given you some homework
Yeah.
so that you can help us get something done.
Thank you.
We
Madam
just-
Chair,
We just went through our endorsement process and we had about 44 candidates who sought our endorsement.
Wow.
So we're going to be reaching out to them and talking to them about, drafting, sponsoring, co-sponsoring, and voting 100% of the time to pass some of this stuff. But if you can send us some language, that would really help, because as you know, we are the last all-volunteer force legislative body, and they don't have the resources, the staff, or the time.
That's what I'm here for, and I'm happy to do that. And it's one of the things that I'm really proud about with our office is we don't ask states to do something that we don't have examples for. And so we really pride ourselves in that, and I would love to share what we have. I also have that sheet, which I don't think we need to put up, but I think maybe you can share with the attendees to share kind of with each issue. I think someone said kind of like not a grading, but kind of the bar that shows how many states have passed each of our initiatives, and also notes about where this.
Okay.
There it is. Yep, that's right. So I don't need. I've already walked through each of these, but it is something that you could use when you're working with legislators as well.
And to let you know, Ivan is putting this and your PowerPoint presentation up on our website, so we can draw everybody to take a look at it there. And if they've got any questions, they can come to us. I'd like to ask one question. Greg and I were in a meeting, and Dorothy, but I think she's secured. We don't seem to have a process for counting the number of veterans in our states, counties, districts. We don't seem to have that information. And we met with the state DVS, and I know other states do this. When you have time, if you could think about that, and if there's a way that other states are doing it, because, if you don't have the data, it's very hard to have a strong argument for passing certain legislature.
Mm-hmm. Absolutely. I've heard that question before from some states, and I know for sure that some states, such as California, do it by city, county, and state level. So I know it's available and feasible. It's just a matter of really the state knowing who to work with. The Defense Manpower Data Center used to be the kind of the go-to. But I'm not sure if that's still the contact, but I'll reach out to my contacts with the data folks and see. We are usually looking at active duty numbers, but I have received that question before. So let me do some digging and see if I can help.
I think it's just basically, if you ask the question and you get a response, we need to capture that. And that would be really helpful. Anyway, thank you so much. And if we don't have any other questions, I want to, again, we really appreciate your time this evening, and I'm enjoying developing a working relationship with you. And I hope that you know that the caucus is here to try to help what you're doing so that we can help the veterans, military, and family members in our state.
Absolutely. It's my pleasure.
All right.
I think Shannon.
Here.
I had another question. I'm sorry.
I think Rudy's trying to get in to ask the question as well.
Okay.
Oh, Rudy, please, sir.
Thank you, Madam Chair, and absolutely thank you, Kelly, for your presentation. Awesome. In some of your presentations, you mentioned about the collaboration with the military bases in the state. One specific question I was wondering about, is there any kind of collaboration between military bases and the New Mexico DD waiver program?
Did you said DV? I didn't catch that. What waiver?
David, it's disabled,
Developmental disabilities.
developmental disability, yes.
Yeah.
Oh, yes, the Medicaid waiver, right?
Right.
Yes. I'll have to, that was one of our issues from a couple of years ago where we were asking states to look at that waiver that for specific to I think it was a home and community-based services for those that are developmentally disabled. I don't know the status off the top of my head since New Mexico wasn't my state during that time, but I can look and see what we've done and kind of where New Mexico stands with what we were asking. But we were really just looking at the waiting list for the home and community-based services and asking that if a military family was on a waiting list, that they could their spot could be held if they were transferred somewhere else and come and return.
Thank you very much. One last comment, question, or whatever you want to call it. I guess I'm one of the former schmoes.
Me
because
too.
the licensure, the reciprocity licensure legislation was first introduced in 2013. And then since then, there's been very, very many variations. But it's pretty easy for someone looking in to see the actual workings of how a piece of legislation is amended, re-amended, reintroduced till you get to where we're at now. And I think there's a lot of progress being made. However, it seems like every time that it's voted on and sent to the governor, somebody brings in another amendment, and there we go, another delay. So thank you, Madam Chair.
Thank you. Thank you.
Of course. Okay. That's a good point. And, so many of these issues have languished for so long. We've done studies, and then the whole legislative body turns over, and then you bring it up
Right.
again, and then they want another study. It's
Right.
just, it's ridiculous. It's just so much
Mind-boggling.
inequity. Yeah.
The question I wanted, there are a lot of different agencies. It doesn't seem to be a clearinghouse. Like the brain trauma, there are agencies that deal with people with brain traumas, some of which could be veteran related, or the VA hospitals, but you don't have an idea of from a census point of view, who's missing. Like I met a disabled vet who got his closed head trauma, not from military service. He is an unhoused person, and I was helping him out. I met him at Bullhead Dog Park, but he got it from a motorcycle accident. He's a self-proclaimed hellraiser, but he's at the VA hospital. But he had no know-how. He got priced out of the housing market. So I ended up driving him. He didn't have a car. His car broke down, to the New Mexico Educators Credit Union so he could get some money to get his car towed to a friend's house who was going to let him stay there. And I just saw him recently, and his sister let him buy a van, like a small RV, which he's living in. But there are so many people who are out in the fringes, and it's very difficult to get a grasp on those numbers. If everybody you meet has a need, then you're probably like what the surgical, you say, if you get everybody, then your net has too many holes because you're missing the people outside. I mean, you have to make the net a little so that you catch everybody. And I don't know, that's the goal. That's the ultimate goal, I think. And I feel like I'm interested in helping on the people who are on the fringes, who are actually, when you look at the costs to our economy, you know, even in healthcare, 10 or 15% of people may account for 75% of healthcare costs. And we have to put our arms around those people, and we have to protect them. And, you know, by preventing sexual assault, and, you know, we may need to change the metrics, or what we're looking at, how we define success. You know, it's a very complicated process, but I want to thank you for all the work you've done on this. And I'm going to get in touch with Greg. I've been out of the childcare thing for like a dozen years, but I'm going to do a little recon and see what's going on, because Diane told me about this meeting, and it's like you don't realize what's not going on until you come to a meeting like this and you go, oh my goodness, I'm a schmo, you know. I didn't know. And so now that I know, I want to do something about it. So thank you. Thanks, Diane. I don't know if you're still on, but thank you.
Yeah, Diane's still on. Well, thank you, Myrna. I was going to ask for your contact information, but I'll get it from Diane. I'd love to
Okay.
talk with you later in the week.
Okay.
So we are early, but that's okay. People have evenings and dinners and things to get to. So Kelly, again, thank you so much. And we're going to stay in contact, and I look forward to speaking with you soon.
Absolutely. And I'll be bombing your inbox.
Good. Do it. All right.
Thank you
Thank you
all.
so much.
I really
Have a nice evening.
Bye.
Bye-bye.